host for the day on this important occasion.
The executive branch of the we must be
senior government officials, Subdivisional Medical Officer Dr. Shah, the Board of Visitors, Chairman and members. We have visitors all the way from Australia. Welcome to Fiji. Invited guests, doc, staff of Nadi Hospital, our media partners, ladies and gentlemen, Assalamu alaikum, Nisambula Vinaka, and a very, very good morning to you all. Nadi always gives me a lot of pleasure because this is my hometown. And in this very hospital, me and my siblings were born, 5 of us. And in this very hospital, my dad passed away. So the whole idea of renovating the old wing, which I believe was closed for 15 years, came during my first visit to the hospital. And I think I was met up with the board and the staff, and I said, I want to go and see the place where my dad died, because I still remembered that. So we walked across the corridor here, and when we went to that area, I was surprised to see it was in a very bad state. So at that time, the chairman of the Board of Visitors was here, and he said there were plans to sort of refurbish and reconstruct some of the areas that was probably worn down over the last 15 years or so. And then we initiated the plan, said, okay, the ministry will come on board and assist the Board of Visitors to see that we get the place back up and running. And I think after a year and a half, less than a year and a half, we're here to see the SOPD clinic open. I am told that the services already started some months ago, and today is the official opening for the newly refurbished SOPD clinic for the hospital and for the people of Fiji. So again, like I said, it's indeed a pleasure for me to be here, and I'm very much confident that the new facility that has been brought about by the Board of Visitors and our partners, which I'll mention later on, will definitely improve the quality of service to our fellow Fijians. And of course, the patients would be more comfortable walking now, because the whole idea was to divert the long waiting queues in the general outpatients department. And the whole idea was to reduce the waiting times and to ensure that the service delivery is lifted to another level. And I'm glad to say that the SOPD has its own pharmacy as well. So our patients do not need to queue up for medicines as well. So, ladies and gentlemen, before I proceed, please allow me to take this opportunity to thank once again the Nadi Board of Visitors in conjunction with Coptic Care and Coptic Care International, our donor partners all the way from Melbourne, Australia, the contractors, and all those who have assisted in the completion of this wonderful, wonderful project and structure. So, big binaka vakalevu to all of you. And if I may again make mention, the whole idea or the main aim was to make use of the existing structures and buildings that were already in place, and to ensure that we diverted the SOPD clinic from the GOPD clinic, and to reduce overcrowding, to reduce long waiting hours, and to give probably a lifted level of service delivery to our patients. As a way of background, Nadi Subdivision Hospital has a population close to 100,000, so we serve close to 100,000 people, with about 1,000 visiting our clinics every month. An average of 350 patients are seen in GOPD daily, and numbers going up to a max of 500. This may be at times, I believe at times leads to a lot of complaints and frustrations among our general public. And so to address these issues, Ministry partnered with our stakeholders present here today to see how best this could be resolved, and you see the results of that partnership and collaboration today. Of course, for me, building infrastructure is very important. For the government as a whole, building an infrastructure is very important, but it is the care that is provided at the facilities by medical professionals is also very important. We can build $1 million structures and facilities, but if the delivery and the level of delivery or the level of care that is provided within our facilities is not up to standards, then the whole idea of building multi-million-dollar facilities is sort of defeated. So I appeal to the staff here, SDMO, under your leadership. I believe the staff will do justice and provide the much-needed service to our people who visit this hospital. And I believe that the new SOPD has just been planned to address the needs of our people. The services envisioned to be provided by this department will include diabetic comprehensive care, mental health, hypertension, asthma clinic, medical clinic, surgical clinic, and of course we'll try to coordinate outreach activities by actively following defaulters. We have a lot of patients who do not turn up to the health centers, and this clinic will see how best we can reach out to these defaulters and help them manage their conditions. And of course, patient counseling and education will also be a priority for this clinic. Ladies and gentlemen, Ministry of Health and Medical Services is doing all that so we can accommodate your needs in terms of infrastructure works. And like you've just heard, for 15 years this building was all closed up. I think the chairman will talk about how much has been put in to ensure that we get the services back in running. And I'm also pleased to announce that we have allocated $2 million for general maintenance of Nadi Hospital, and I'm happy to say that the works will start at the end of next month, and we anticipate that major maintenance work will be completed by November 2018. So this is indeed good news for the people of Nadi. And at the same note, on the same token, we're going to refurbish. There's going to be a refurbishment works also being done at Nambawalu Subdivisional Hospital, and again, will begin at the same time as Nadi Hospital. Many a times we are asked questions about the deteriorating state, the dilapidated state of infrastructure, and we tend to blame people. We've got to understand that these are years and years and decades of neglect that we are trying to improve on. So obviously it's going to take time, but as a government, as a ministry, we are committed to ensuring that not only do we improve on our physical infrastructure, but we also improve on the quality of care that we need to provide to our people. The various improvement works, ladies and gentlemen, and the building of new facilities. Last week we announced Valelevu Health Center as a 24-hour service, and over the last 5 years, I was looking at the budget that the ministry had allocated, or the government had allocated, to maintenance work for building new facilities, upgrading and maintenance work. It came to about $100.1 million. So obviously this work has to go on, and with that, I'm sure in the near future we will be able to have facilities that are up to standards. And we are all doing that as a sign of our dedication to our people, because we believe that your health is also our concern. And however we provide the service, and your responsibility, I believe, is to ensure that you take care of your health. We will take care of the buildings. Please, as public, you need to take care of your health as well. Building new facilities and bringing in more modernized equipment and technology should not encourage people to fail in looking after their health. That's also very important. And on this note, I'd also like to highlight one of the areas of concern that is for us as a ministry is the rise in NCDs. I mean, you can never stop talking about it. You've got to understand that in the Pacific we have one of the highest rates of NCDs, high blood pressure, diabetes, and the list goes on. And the number of amputations that we do within our hospital facilities where our Fijians lose their limbs is also a concern for us. And again, SOPD clinics such as this is a good way to ensure that people manage their health, to ensure that they do not come to a stage where somebody has to lose a limb, somebody has to lose an eye. And we've always said that NCDs pose a double financial burden on our health system. Okay? NCDs affect families, NCDs affect children, it affects the productivity of the nation as a whole. So my appeal to all Fijians would be to ensure that you don't fail in looking after your health. Ladies and gentlemen, according to data collected by the Health and Information Unit of the Ministry of Health, a total of 669 amputations were recorded in 2015. So basically, 669 families were affected by these amputations. And the way we are going, if these are not managed well, we're looking at numbers rising in the near future. These statistics actually convey a very, very alarming trend. And of course, the consequences of diabetes among our people is rising and needs to be seriously looked at. Tackling NCDs doesn't mean building more hospitals. Tackling NCDs doesn't mean bringing in more medicine. So how do you tackle NCDs? Is getting people to be serious about their health. Eating right, eating the right amount of food, eating healthy fruits and vegetables, exercising regularly, and of course creating awareness among all members of the community to ensure that we make that healthy choice and we are committed to that healthy choice. And all that comes with self-discipline. All that comes with self-discipline. The doctors and the nurses would tell you what to do, but what you actually do is your responsibility. So, like I said, the doctors can only advise on what's to be done. The onus lies on individuals to ensure that we stay away from unhealthy lifestyles. So it's a new year, good start to new year. Let's appeal to all the families, all responsible families of Fiji, to ensure that you truly care for the health of yourself, your children and the loved ones, so that you have a healthy and a happier life. So ladies and gentlemen, in conclusion, I'd like to once again thank all our stakeholders, Coptic Care Limited, Coptic Care International, our Board of Visitors, the hardworking chairman and his members, the hardworking staff of Nadi Hospital, and of course we need to take these services out to the people. And I always say the success of a hospital is the reduced numbers of people coming through its doors. Okay, so hopefully in the coming months you will see a lot of maintenance and infrastructure upgrade happening around the hospital. But ladies and gentlemen, that should not affect the service delivery that we are to give to our people. So on this note, may I wish you all a belated Happy New Year. We are ending January, and I hope that we have a healthy and a fruitful and a blessed 2018. Thank you very much, and I declare the new Special Outpatients Department open. Thank you.
No, I think about it. This is now very different.
This was my concern, Krishna.
No, it's the middle one.
The middle one. The middle one?
No, that's the middle one, I think. With the closest
That's it.
Okay.
Yeah, this used to be the old.
I drove by, so the changes there.
But
Let's go.
basically putting 1,000 people